Okay, it's 12:30. We're going to start. Good afternoon. I'm Gurjeet Kalkat, the Chief Medical Officer at MRNA Health. Thank you for joining this special presentation on coronavirus pandemic. Just a few housekeeping issues in the beginning. We are going to have our keynote speaker, our presentation going to be done by Dr. Jayasekara, who is an infectious disease physician at MRNA Health for more than 20 years. Before we go to the presentation, I'm going to give you a short update on where we are as far as the coronavirus pandemic is concerned locally. Then a few points about the vaccine itself, and then we have the presentation, and we'll hopefully have, I think, lots of questions about this evolving topic. So as far as COVID-19 pandemic is concerned in our area, we know that it was pretty bad earlier this year. We had up to 160 cases in July and August. Today we have 43 patients in our hospitals, Queen of the Valley, Foothill Press, and Intercommunity. 21 at Queens, 11 each at Foothill Press and Intercommunity. So far we've had 190 deaths from this disease, sadly. Again, 75% of these deaths have been in patients over the age of 65. As you may have seen, there has been an uptick in the recent few days in the number of cases. Our numbers have gone up too, but not as bad as they happened in July and August. We expect them to get worse for many, many reasons. We are hoping for the best, but we are prepared for the worst. We have adequate PPE. We have more therapeutics, whether it's in the form of steroids and other drugs, to take care of these patients if they do fall sick. Now, a little bit about the topic about COVID vaccine. So as we know, to really stamp out a disease, a vaccine does the job the best. Right now, we do not have any good antiviral to kill this virus. If somebody does get the disease, remdesivir, the drug approved, is effective, but not 100%. So we need the vaccine or vaccines to stamp out COVID-19 so that we can come out of this pandemic sometimes next year. So how we got into this was that we knew this vaccine was coming out. We approached our local health authorities and we offered our services as so-called MPOD, which stands for Medication Point of Dispensation. So they chose us, and that's why we are ahead of many of the other hospitals in the area to offer the vaccine to our employees and medical staff. For those who want to follow the vaccine status, there are up to 150 of them being developed in different parts of the world. There is a very nice site operated by New York Times called Corona Vaccine Tracker. And right now there are 54 trials going on in the world, human trials with these vaccines. In the US, we have 11 of them. So, but we know we have 4 front runners. And of the 4, 2 have already come out with findings of their phase 3 trials, the Pfizer trial and the Moderna trial. We, having been told that we will be a medication point of dispensation, we started preparing for this vaccination program. We were aware of the special requirements for some of these vaccines. We have acquired an ultra low temperature freezer, which can store especially the Pfizer vaccine. And then we have engaged our medical staff office as well as our employee health department to design a vaccination program, which is near completion. For the physicians on the call, you will be approaching the medical staff office as well as employee health to get these vaccines. For the employees, we already have a platform called the Axion. They will register on that just like they register for the influenza vaccine and then come to the vaccination clinic. We have been told by the local authorities that we will be getting one of the 2 or both Moderna and the Pfizer vaccines. We are awaiting more information on that. We expect the vaccines to be getting emergency use authorization by FDA sometimes in the beginning of next month. Emergency use authorization is being asked for by these two companies in the next few days. Once we have the vaccine, we will roll it out. And now I'm going to go on to Dr. Jayasekara, who's going to make the presentation. And then afterwards, we'll tackle, I'm sure, many, many questions. Dr. Jayasekara, thank you.
All right, thank you, Dr. Kalkat, for that lovely introduction. As you know, we are all going viral with this virus, as well as the vaccine. So this is a pivotal time for us and an exciting time for all the scientists and the doctors, especially infectious disease doctors. Now that more and more vaccines are coming out, we have two front runners already making news. And when you talk about vaccine development, as we know, the main structure of this main component of the structure of the virus is the S protein, which you can see on this cartoon really well. There are other proteins, the protein, which could be targets for vaccine and therapeutic developments later on. So as we all know very well now, that this is a single-stranded RNA vaccine with a spherical envelope, and it's found in birds and mammals only. There are two alphas and two betas which cause human diseases. A benign human common cold, about 30% of common colds caused by coronaviruses year in, year out. But the zoonotic viruses that cause SARS, MERS, and COVID-19, those are much more virulent, much more disease-causing than the other coronaviruses. And the pathogenesis is given very briefly here. Transmission is via airborne transmission and droplet transmission, depending on the size of the particles. And once the site, when the cells are infected, generally this virus binds onto the cell through ACE2 receptors. All right. So when they are bound to the cells, they're differentiated into the respiratory epithelium and infect the cells. So I know this is something that we all are experiencing at this point, something that I call a pandemic fatigue. We are fatigued, we are sick and tired of being quarantined and washing our hands and not taking all these precautions. But unfortunately, there's no way out, guys. Next 1 to 2 years, we will probably have to continue these mitigation steps over and over again religiously. So yes, we are fatigued, yes, we are tired, but we still have to focus on these steps. Now, how do we return to normalcy? These are the steps that we lecture on day in and day out, right? We, at the end of the day, we have to still think for ourselves: have we taken these steps today? Are we going to redo it tomorrow? Right, like that. So the mitigation pools that I put forward are the hand hygiene, social distancing, mask, and self-screening. Change of culture and behaviors are very important, as you know. Especially with the holidays coming into the picture, surveillance testing and contact tracing, and the safeguards for workplaces such as plexiglass barriers. And now we are talking about the most exciting news about vaccines. And when we talk about COVID-19 vaccines, we cannot forget the influenza vaccine and pneumococcal vaccines. You folks will have to take your COVID influenza vaccine. Everybody over 6 months of age will need, especially this year, we don't need a twindemic. So in order to remember the prevention steps, I've put together a little formula called DREAM. So DREAM to prevent and DRAPE to treat. It's an easy way to remember. DREAM means distancing, respiratory etiquettes, aseptic technique for hand washing and sanitization, mass, and I've added another M called mRNA vaccines based on Pfizer and Moderna vaccines. And to treat, easy way to remember would be DRAPE, D-R-A-P-E, DRAPE to treat, dexamethasone, remdesivir, ancillary vitamin C, vitamin D3, and zinc sulfate. Antibody cocktails have been added. We just had the emergency approval from FDA for Eli Lilly antibody, monoclonal antibody. So that's exciting news. That's to treat mild to moderate cases before hospitalization. And then P for plasma, P for plasma means convalescent plasma, and then P for proning, and then last but not least, enoxaparin is an anticoagulant, like Lovinox. So this is a cartoon that you are only too familiar with, but I want to point out once the virus enters the body through ACE2 receptors, and it goes through the translation assembly process, the viruses have been presented to the antigen-presenting cells, and the body will react by producing neutralizing antibodies. So there are two types of immunity that we come across for any infections: T-cell immunity and B-cell immunity. B-cell immunity deals with neutralizing antibodies. So that's the mechanism that the vaccine developers are going after. So timeline for the development of various vaccines, as you know, we generally used a traditional or conventional vaccine such as polio. Polio took about more than 60 years to develop, right? That's what we go through, that's what the scientists go through in order to produce a robust vaccine, polio vaccine, the oral polio vaccine followed by intramuscular. So polio has been eradicated thanks to this vaccine. So vaccines are the only exit strategy. So polio has been eradicated from the world except 3 countries: Pakistan, Afghanistan, and Nigeria. Now we can transition to intramuscular one because of that. Now, Ebola caused a lot of havoc in 2015 and then 2019. The way the scientists dealt with 2019 pandemic or epidemic of Ebola is by way of a vaccine. There was a good vaccine that they came up with called Ervebo, E-R-V-E-B-O, which is shown on this slide. But when it comes to respiratory virus, it's very, very difficult to come up with a good vaccine. So that's why SARS and MERS vaccines failed. There was lack of funding too. And now COVID-19, we have come up with a vaccine, or multiple vaccines within a matter of 10 months. That's a great, huge success. How long does it take to develop a vaccine? Typically 10 to 15 years, but most of these diseases were dealt with vaccines. They were developed over 30, 40 years. Most recent ones were hepatitis B and C. Hepatitis B took 17 years and hepatitis A took 25 years. As you know, all these diseases or the infections were finally addressed head on with the vaccines. Now, how do we develop an ideal vaccine? You have to go through the sequence of events, identification of the platform with research and development, followed by preclinical studies, and then target validation. And once you do that, you get into clinical stages: phase 1 about safety, phase 2 about safety and efficacy, and phase 3 about everything, right? So we have gone through all those stages with COVID-19, and now we have come to the logistic part of it. Before distributing and before the licensure, we have to look into the logistic part of it. Now, human challenge trials have been used to hasten the process of phase 3, right? Over the years, we've seen for smallpox, Edward Jenner deliberately exposed his gardener's son to cowpox in 1796. Smallpox was eradicated. I believe it was in 1982. We eradicated smallpox. And the same goes with H1N1 pandemic, 2009. We used human challenge trials to produce vaccines swiftly. And malaria, we still don't have a vaccine. Dengue is a different story. Dengue virus can actually cause a cytokine storm called dengue hemorrhagic shock syndrome. So we can talk a little bit about it later. So I'm going to dive right into the vaccines under development for COVID-19. As you know, this is about 5-6 month old slide. At this point, we did not have Pfizer. So Pfizer was a new kid on the block at that time. Pfizer and Moderna made a beeline to the front over the last few months. But 4, 5, 6 months ago, it was University of Oxford and AstraZeneca vaccine that was leading the bunch. As you know, there are 2 main platforms that we're going to talk about for vaccine development against COVID-19. One is mRNA platform. mRNA, there are 2 vaccines that used mRNA, which are Pfizer and Moderna. But there's another time-honored mechanism or a platform called non-replicating viral vector. And that has been used over the years against infections such as hepatitis B, Nipah virus, and Zika, and Ebola virus. All those things were a classic example would be the CHAD OX1, which is chimpanzee adenovirus. A viral vector was used by University of Oxford for the previous vaccines, chikungunya and Zika, and so on. Some of those vaccines were successful, others were not. And another very successful one was adenovirus 26, which was used by J&J, Johnson & Johnson. So that's how Ebola virus came into the picture. So today we are going to talk about other adenoviruses, adenovirus type 5, which is used by a Chinese vaccine maker. There are several Chinese vaccine makers who are in their phase 3 trials right now, and there's a Russian vaccine maker in phase 3 trials. So these companies are competing with each other to do the right thing. So when you talk about vaccines for a pandemic, we have to talk about two governing bodies or the alliances that are in charge. Now, World Health Organization, they put together a alliance called COVID-19 Global Vaccine Alliance. The name is COVAX, C-O-V-A-X, which is given on this screen. This is the vaccine pillar of ACT Accelerator, which is the Access for COVID Tools Accelerator, and so that this will make sure that the entire world will get a fair share of the vaccine. It is launched by 3 organizations, WHO, Gavi, and CEPI. CEPI is Coalition for Epidemic Preparedness Innovations, and 184 countries are working in collaboration with WHO for this. More than 100 candidate vaccines are under development at this point. They promise 2 billion doses of COVID-19 vaccine by the end of 2021. More than $1.5 billion are pledged for global accessibility and fair distribution of these vaccines. In the United States, we have this initiative called Operation Warp Speed. This is the government initiative to mitigate the financial risks of vaccine and therapeutic development by providing fundings to those companies. It's a partnership between DHHS, which is Department of Health and Human Sciences Services, CDC, NIH, BARDA, and Department of Defense. This coordinates NIH accelerating COVID-19 therapeutic intervention and vaccines called Active and Rapid Acceleration of Diagnosis, RADX initiative, and work by BARDA. HHS announced in March, that was the very first company that got the sponsorship by Operation Warp Speed, Johnson & Johnson. 450 million were given to them. And the other partners joined in after that, such as Pfizer, Moderna, AstraZeneca, Regeneron, which came up with a monoclonal antibody, and Sanofi and GSK, and last but not least, Convalescent Plasma Project. Now, Pfizer did receive some sponsorship, but they used their own money after that. So what are the 4 leading COVID-19 vaccines? We are proud to say that we have 4 competing COVID-19 vaccines at this point, at the end of phase 3 trials, which are, or towards the end of phase 3 trials, I should say, which are Pfizer with BioNTech, which is BNT162b1, Moderna Vaccine, and AstraZeneca and Oxford Vaccine, and Janssen Vaccine. We can talk a little bit about these vaccines later on. So Pfizer vaccine is administered in 2 doses, 3 weeks interval. It is an mRNA vaccine. Now, mRNA is a brand new concept. It has never been approved before, FDA approved before. So it's been proven effective and safe by Pfizer as well as Moderna this time around. 90% effective. Now, today they made an announcement they are 95% effective. So we are proud to say that we have a vaccine which is 95%. It's very hard to produce a respiratory vaccine at that level. So these scientists had worked hard ever since the virus was decoded by the Chinese scientists in January 2020. 46,000 volunteers were enrolled in phase 3 trials, so much more than the other companies. Side effects, luckily for us, only mild fever, injection site pain, and headaches. And the worst case scenario, severe hangover effect, they say. The real challenge is the storage and transportation, sub-zero, -90 or -70 Celsius. awaiting peer review. That's the final process by independent scientists. We still don't have those data, and we still don't have the final safety data. 50 million doses pledged globally by the end of December, 1.3 billion doses next year. So continuing on Pfizer vaccine, plans to distribute via thermal shipper. Now, the local health authorities are already talking about it. They're going to give it to you, your nearest hospital, by way of thermal shippers at -60 to -80 degrees, which are stable for 10 days unopened, 5 days opened with dry ice. The box must be returned after the use to Pfizer. If stored in the refrigerator, stable for 5 days. But dilution is required, unlike the Moderna vaccine. So the shelf time is 6 hours outside. Moderna vaccine, which is also an mRNA vaccine, encodes for a form of S protein, the spike protein outside the virus. This is co-developed by the NIH and Moderna. So that's its feather in their cap. Phase 3 trials included 30,000 volunteers administered in 2 doses, 3 to 4 weeks apart. Efficacy and safety data are still pending, but today, among the last few days, they announced that it's 94% effective, right? 94% effective in preventing COVID-19 infection. When they say 94 to 95% effective, that it's effective in preventing the diseases, but how much is it preventing in the prevention of serious disease, hospitalizations, or ICU admissions? We still don't know. All those data are going to be out very soon through this COVE trial database. COVE trial, which is the Moderna vaccine trial, has found no serious side effects. That's such a blessing. 20 million doses will be projected by the end of the year. Common side effects are very similar: injection site pain, headaches, and fatigue. Stable at room refrigerated temperature for 1 month and frozen 6 months. So that's a huge plus for Moderna vaccine compared to Pfizer vaccine. It is stable at refrigerated temperature. We don't need those sub-zero, ultra sub-zero temperatures. No dilution is required at point of care, which is such a blessing too. So Johnson & Johnson vaccine will resume as we speak with 60,000 volunteers after it was halted in mid-October for an unknown side effect. It's called Ensemble trial. Only 1 dose required, so that's a huge plus for them. And storage in warmer, storage and transportation in warm temperatures, which is also a huge plus for them. So I'm going to move on to the next slide, which is the platform used for Johnson & Johnson. Is a time-honored platform, which is a viral vector platform called AD26, adenovirus 26. So it's been trialed before. Trial paused in 2020, October 2020, after an adverse event in a participant, but it was reviewed and monitored by the Data and Safety Monitoring Board, and planned to get FDA authorization early 2021. Projects 1 billion doses, so that's a lot of doses each year. And the Oxford vaccine is still out there, phase 3 clinical trials. It's called ChAd-Ox1 viral vector, an adenovirus vaccine vector, given in 2 doses, 28 days apart, in partnership with the World Health Organization as well as Operation Warp Speed. In 2018, these partners used the same platform for Lassa, MERS, which was unsuccessful, and Nipah vaccines. Transverse myelitis was a problem in one of the studies, study participants, but they monitored that and then reviewed that and then cleared the study to continue. So this is a cartoon of that chimpanzee adenovirus once it enters the body, how it produces the antibodies. Sanofi and Glaxo vaccine is an adjuvated recombinant protein-based vaccine. 200 million doses pledged to WHO, 100 million doses pledged to Operation Warp Speed in the United States. 2 doses, again, 28 days apart. Phase 3 clinical trials will be ending by the end of 2020. Novavax Vaccine, which is a very unique concept called nanoparticle concept, nano methodology. It's a type of vaccine that will use full-strength recombinant SARS virus nanoparticle vaccine adjuvated with matrix M. 2 vaccines, again, 3 weeks apart, currently in phase 3 trials, and they are working in collaboration with both WHO as well as Operation Warp Speed. It's important to note that some of these virus vaccines, especially viral vaccines, have had major side effects in the historically, such as the dengue hemorrhagic shock syndrome with dengue vaccine. So the primary goal of this vaccine is safety, especially times like this when the numbers are staggering out there. This is the only exit strategy, but we still need to remember there have been some major side effects with some vaccines that has caused cytokine storm. So these two mechanisms are called ADE and VAERD. So ADE stands for vaccine enhanced antibody dependent enhancement. The other mechanism is vaccine associated enhanced respiratory disease. This is very, very, very rare, and it actually happened with the dengue virus, and they've come around. They actually found a way out of that kind of side effects. So I think we got a safe set of vaccines, efficacious, very effective at this point. So it's up to us to decide whether we should take it or not. I think I'm going to complete my talk with this slide. I would like to thank everybody for participating, joining us here, but mostly big salute and hats off to the healthcare workers. Thank you, guys.
Thanks. Thanks, Dr. Jayasekara. Really a great insight into this evolving, developing topic. So a few comments and observations before we take on the questions. The influenza season is upon us. Fortunately, the influenza activity is very, very low here. Right now, we have only one case in our hospitals till yesterday. So that's helping us. And people have been taking their influenza vaccine very diligently. So that's very helpful. For the employees and everybody else watching, this vaccine is not going to be mandatory. That was the #1 question, but it's strongly recommended because if you are a frontline worker. As Dr. Jay mentioned, that it is not a live vaccine, so nobody will get the disease from this. It's very, very important. And then about the side effects, it's really a lot of fear on the net everywhere about side effects. So every vaccine has some side effects. They have observed up to 10% side effects, whether it's local pain or fever up to a day or two. For that reason, we recommend taking it, if you have a day off the next day, if you are one of those 10% who will get these side effects. But it's the adverse effects which really, really matter. The adverse effects profile of these two vaccines is very, very good so far. We haven't had what happened with Oxford vaccine, transverse myelitis. For these two, we have been fortunate. The adverse effects are practically none for now. But then comes the issue of rollout. So the CDC has a playbook. You can Google this, called CDC COVID vaccine playbook, which was updated only last week. It tells you how it was developed, how it's going to be rolled out among various populations. The hospital population is considered a critical population, and that we have a phase 1A trial, phase 1A, phase 1B. In phase 1, we have the physicians, the nurses, the lab techs, the EVS employees who are the target. In the second phase will be folks around us in the nursing homes, and then would be the law enforcement officers, teachers, and even our EMTs who bring these patients to us. So that playbook is available to anybody who wants to know how it's going to be rolled out. But as far as we are concerned at Emanate, we are going to offer it to our employees and our medical staff. The first question is, how long will the vaccine last? I'll have Dr. Jay answer that.
So that's a great question. So the answer is we don't know. Because these kind of things are very experience-based, right? We don't have enough data to say that the vaccine effect will last this long. But we know for a fact that if you're infected, you're going to produce neutralizing antibodies. Those neutralizing antibodies will last for about 3 months. That's the reason why we gave this exit strategy. Whether you were infected or not, when you receive a vaccine, those antibodies will last for a long period of time. We are hoping that it'll last for a couple of years, at least a year. Some of those vaccines developed before, such as MMR and chickenpox, they last forever. It's a lifetime, right? Just like getting the infection. So the short answer, we still don't know. We'd like to say that it'll last at least for a year.
It's part of the evolving story. Then the next question is, if one has had prior COVID-19, the answer to that is right now there is no guidance as far as CDC or FDA is concerned, where if somebody's had previous COVID-19, then they should get vaccinated. Next question is the vaccine safe for pregnant and breastfeeding? Dr. Jay?
Yeah, so again, there are lots of unknowns about this vaccine. I think one of the vaccines, Moderna, has not tried it in children and pregnant women. So they clearly say that there are no data available in children and pregnant women.
Okay, all right. And then the other important thing is, if I get the vaccine, would I be wearing the mask afterwards? And that's a very, very interesting question. The answer is yes, because firstly, it doesn't give you 100% protection. Secondly, you can still get a mild case and you can maybe even transmit this thing. We don't know as yet. So the bottom line is masks and other protective measures are not going away for at least a year. Deepthi, would you agree with that?
Yes, that's exactly why we discuss an easy way to remember this formula, DREAM, right? So DREAM formula will continue at least for a couple of years, and that's not going to take away the initiative from the vaccine prevention from the mask. So mask will only help the cause, but that's not the. No, I'm talking about the vaccine. Vaccines only help the cause, but it's not going to be it. Yes, you will still have to wear a mask and continue to take these mitigation steps in order to get through this process.
All right. A couple more questions I'll answer. The vaccine will be, of course, free even to the general public. Right now we are being promised the Moderna and the Pfizer. As more vaccines come along, we will be providing that whatever we get from our Department of Public Health. But with these two vaccines at 95% efficacy, I doubt anybody can really beat them, but I will be happy if anybody beats their numbers. Will somebody have to get their COVID-19 test done before they get the vaccine? Deepthi, you can take that. I have the answer. Go ahead.
Again, we still don't know the exact science behind that. I can tell you one thing. Even if you get the COVID-19 test just right before the vaccine, one thing is it practical to be tested for COVID-19? I mean, we are talking about millions and millions of people, right? So far, they haven't, CDC has not shown us that there's an advantage of taking a test before the vaccine. So the answer is no, you don't have to take the test. Take a test before the vaccine.
I'll be honest, I have questions which I cannot even fill on my screen. So we'll try to answer all we can. Whatever is not answered, we will answer them. If you send us a link, we will definitely answer all these questions on all those folks who have signed on. Interaction between COVID vaccine and influenza. There is only one trial which is going on, which is doing both at the same time, but right now we don't have any information on that. Rollout to general public, it's probably going to happen in the second quarter of next year, not before that. Right now we are focusing on the phase 1 critical population, as I mentioned before. If the employee takes the vaccine has had bad side effects, what's the protocol? That's coming from one of our employees. Deepthi, you want to answer that one? I'll look at the other questions.
Yes. So if somebody develops a bad side effect, yeah, definitely you need to report that. And I honestly don't know what exactly to be done afterwards, but so far we are not talking about bad side effects. Actually, both these vaccines have had no serious side effects.
Yeah, so just to add to that, there is actually going to be an app rolled out by CDC called VSafe, Vaccine Safe. It'll be on your smartphone. If you have, they will encourage you to report side effects. There's also another reporting mechanism called VAER, Vaccine Adverse Events Recording. That will be done by your provider, whether a nurse or physicians, and we always do report adverse effects, not side effects, adverse effects to CDC. Another question, will the vaccine impact COVID-19 serology testing later on? Let's say if I get the vaccine and I'm one of those 5-10% who did not get the immunity. If I get COVID, will that affect the testing? The answer is no, correct?
Yeah, that's right.
Because that's a the COVID test is a PCR test. You will still pick up a PCR even if you if you have the antibodies in your blood. Do spouses of healthcare workers also get vaccine? Good question. Right now, we are limited on our supplies. We are expecting about 5,000 dosages, which will be enough for 2,500 people. So we will give out as much as we can. We don't want to hoard anything, but I think supply limitation is going to be a huge issue as this vaccine program gets rolled out, not only to our critical population, but also to the general population. Has the FDA approved these vaccines as yet? As I was mentioning earlier, the companies are applying for emergency use authorization in the next few days. We expect the FDA to get so-called EUA, emergency use authorization, to come up in the next 2 to 3 weeks. Next question we have, which is better? Which vaccine is better? Deepthi, you want to take that while I look at some questions?
So which vaccine better? We have only 2 vaccines where the data actually are out right now. So but between Moderna and Pfizer vaccine, they are both great vaccines, 95% effective. Safety, no major safety data. So they are both same. It's all about the practicality. If you have a sub-zero freezer that a lot of hospitals are buying right now, well, the Pfizer vaccine is great too. But when you talk about the storage, the shelf life, and also the fact that the last minute preparation have to be done, yeah, maybe Moderna will be a good choice. But frankly speaking, both vaccines are great. They look great at this point.
I mean, this is a huge race going on with so many vaccines being developed, whether it's a mRNA vaccine, whether it's a vector vaccine, whether it's a DNA vaccine, whether it's an inactivated vaccine. We even have an oral vaccine candidate, a patch vaccine candidate. We don't know how many are going to be successful. Maybe more than one. Looks like right now we already have 2 who are winning the race. So we'll see as what we get and how it evolves. Vaccination for kids, from Dr. Go, you want to comment on that, Deepthi?
Yeah, so again, kids have not been now. Kids, as you know, they do not get severe disease, but they could be carriers. They could be asymptomatic carriers that could infect older people, especially the elderly people. So at this point, there's no apparatus to vaccinate kids. Of course, these are constantly evolving stories. There'll be news, releases next few weeks where they would release data from kids. But as I pointed out earlier, Moderna vaccine clearly said they have not tried this in kids and pregnant women.
Yeah, there are some trials going on with kids, as Deepthi said, that kids are not a huge target, so they're actually low on that priority list in getting the vaccines. And then we have a few more. It's 1:08. We can take more questions. Will we have titers drawn to show if the vaccine is working?
Yeah, so that's a $1 million question, right? Now, COVID-19 has not had the luxury of creating these quantitative viral titers at this point. It's done in certain scientific institutes, but there are no quantitative viral titer tests out there commercially. So unfortunately, we can't measure the titers. Like, for instance, I'll give you an example. Hepatitis B. If your titer is less than 10, you need to get a booster, right? So we are not at that level yet. So we have to depend on ongoing science and evolving science about that.
All right. This next question is because what we have with social media. Is this true that this will change our human DNA, these vaccines?
That's another $1 million question. So will this create long-term impact on our DNA and in general our health? It doesn't look like it at this point. We have had pandemics before. The classic example was H1N1, which was an influenza. and affecting or impacting kids a lot at that time. There were a lot of children deaths among children at the time, 2008 and 2009. So obviously H1N1 vaccine came into the picture. We all got 2 vaccines that year and the following year. So whether that created a permanent damage to our DNA, we still don't know. I don't think so. There's a lot of chatter about this without much scientific basis.
Deepthi, I think they're referring to if any of the vaccines will affect our DNA. So this is coming out because of this issue with the nanoparticle. The nanoparticle being used to deliver the vaccine by a few of the companies. They are saying that it could have a computer on it, a nano chip on it. So there's a lot of stuff on the internet, but we do not think this will have any effect on our immune status. Question is, what is your personal opinion on getting the vaccine for yourself? I'll start with myself. If you're a frontline worker, you should get it, irrespective of the age. Of course, then you can prioritize yourself if you're not a frontline worker, whether you want to get it or not. It's not mandatory. I feel comfortable offering it to my family and friends. Deepthi, you want to?
Yeah, same goes with me. I would say now we are frontline workers. We deal with patients day in and day out, and we do follow the DREAM formula, which is distancing, respiratory etiquette, everything, and masks, N95 masks in the hospitals. But I still feel very unsafe. And it all depends on your risk profile as well. So yes, definitely, I would use the data. I would look at the last phase 3 clinical safety data from both companies and make the decision.
Yeah. For that, another question pertaining to that, if they have not reviewed the safety and efficacy, should we even discussing distribution? I'll start the answer with that clearly this is a huge burden on humankind. We are doing things as we go. We want to save as many lives as we can. This is uncharted territory. But as you know, the phase 3 trials involves at least 30,000 patients for each vaccine. So some of them have even gone 40, 60,000. So, and they are pretty careful as far as reporting safety is concerned as adverse effects. So it's going well, but clearly FDA will look at it when they submit the vaccine data to FDA later on this year, and FDA will comment on that. Deepthi, you want to comment any?
Yeah, so unfortunately, the way we are going, we are talking about now second wave with staggering numbers. This is uncharted territory, as Dr. Kakar pointed out. So even with all this mitigation steps that we've taken with the first wave, it's happening right in front of us. Right now, we are admitting a lot of patients, right? You know, it happened late in California and early in other states. So it's raging across the world once again. So I think we are running out of choices. So we have, in order to get rid of this pandemic, I think the only exit strategy, permanent exit strategy, would be the vaccine.
Contraindications to these vaccines are essentially anybody who's had previous history of a neurological condition like Gamberry, but otherwise there's really no documented contraindications to this vaccine. So you cannot say you have allergic to this vaccine because there's never been a vaccine before. Will all the employees get this vaccine? The answer is yes. We are offering it to all the employees, even though some of them are not frontline. If we have the dosages, we want to give it to anybody who we think we can protect during this pandemic. There is another question, will Dr. Calcutt and Dr. J will be getting the vaccine? The answer is yes, and I think Dr. J will agree to that. If it's 95% effective, then 5% of us will not be protected with the vaccine. The answer is correct, yes. That's why the reason that you should still wear a mask after the vaccine. Will there be a priority for elder to obtain after healthcare workers? The answer is yes. That's a phase 1B for the elderly in the community as well in our nursing homes. This one I'll give it to you. What percentage of patients, of folks in the population we need to have to achieve herd immunity?
Yeah, so that's a very common question that I get asked all the time. So in order to have sound herd immunity, you have to have at least 60 to 80%, anywhere between 60 to 80% of the population being infected or vaccinated. So that's why by creating this amount of herd immunity or this amount of numbers with a natural infection is almost impossible, right? That's why we need to focus on the vaccine. Vaccine creates that type of herd immunity.
Good, absolutely. Clearly, I think there's a lot of trepidation, but as we know more about these vaccines, I think one will be more comfortable giving it to or taking it and basically save everybody around us. Can you repeat your statement after Gamberry? So in general, Deepthi, you want to comment? In general, most people who have had Gamberry do not take any vaccines.
Any vaccines, yeah.
Gamberry vaccines.
Exactly. So when you talk about Gamberry is 95% time is a self-limiting disease. Basically, it's an ascending paralysis or paralysis of lower extremities, slight uptrending or ascending type of paralysis or weakness. That's such a common thing after viral illness or any kind of vaccine. There was a time that there was an H1N1 or there was an influenza vaccine that was introduced many years ago that had caused a few cases of Gamberry. So that is a known side effect with many vaccines, and a lot of them are transient, you call it, and self-limiting. But if you have had that kind of history, you don't want to take a respiratory vaccine. That's why Dr. Kalkan mentioned quite rightly, if you have had known history of Gamberry, yeah, you don't want to take that vaccine. And that's pretty much the only thing that I would think of when you talk about contraindications.
Absolutely. There's a question, I think we've answered this. What month of next year do you anticipate vaccine being rolled out at a hospital? We expect this vaccine to come out to us in second week of December. What is more effective, wearing a mask or taking this vaccine if one had to choose? Deepthi, I'll give it to you.
Yeah, I don't think we have a choice at this point. Definitely, the exit strategy is the vaccine or vaccines. Which one is more effective, we can't tell. But masks, even in 95, even the surgical or medical masks are preventing you getting the infection. And 95 masks filters out 95% of the viruses. So obviously, they have to be. Our advice is they have to be used together in order to make a difference.
Okay, then. Thanks. Will the vaccine be available to employees if we decide to get it later? Yes, we will have it as long as we get the supplies from the county. We'll be happy to give it to you. But of course, as I mentioned earlier, this is not mandatory in the beginning. Okay, this is another. I think I've answered this, but let's do it again. Does the vaccine help you prevent spreading COVID-19? Can you still be a carrier? Deepthi?
Yes. Yeah. Yes. In fact, the answer is yes. Because vaccines, these two vaccines, Moderna and Pfizer vaccines, they show 95% efficacy, effectiveness. But we got to read between the lines. It doesn't specifically say it doesn't prevent asymptomatic patients. That's what it is. Yeah. So it could be a carrier.
Yeah. You can still be a carrier. You can have a mild disease, give it to other people. Very. Contraindication about fibromyalgia. Deepthi, you want to comment on that?
Well, the answer is no. The fibromyalgia have not been looked into as a contraindication, at least not declared as a contraindication. Fibromyalgia does have some neurological basis, So if you have had some kind of ascending weakness or history of ascending kind of paralysis or weakness, yeah, definitely that should be considered as a relative contraindication.
All right. There are questions from our Patient Family Advisory Board. When will the public know when to take the vaccine? The answer to that is there's going to be a rollout by CDC as well as your own insurance plans. One of my daughters got a text from CVS that she will be eligible to take the vaccine next month. So everybody, the federal government, the medical groups have collaborated with hospitals, various pharmacies to roll out this vaccine. So more and more is going to be done. But as you mentioned, it's going to be happening most likely the second quarter of this coming year. What data have the drug companies given in response to the vaccine trial studies, gender, age, prior health complications, exposure to COVID? This is all there when these two companies present their data to FDA. Actually, a lot of it is available already. I think I will take a couple more questions. Okay, we can take that. Can it be transferred? I think this is for COVID-19. Can it be transferred from mother to baby? This is more for COVID-19, not about the vaccine. But that's a good question. You can answer that, Deepthi.
Yeah, could it be transmitted from the mother to the baby? Yeah, definitely yes. That's why there are clear guidelines on CDPH as well as CDC websites about breastfeeding, and as it's safe to breastfeed as long as mother takes all precautions, including masks and gloves.
Yeah. To add that, fortunately, newborns do not get really sick from this from COVID-19 when they're really nearly newborn, so they come out fine. So actually, in our mother baby, they don't even separate them anymore because the babies do fine. Yes, the mother is separated from the rest of the family, but not from the baby. So that's good news to know. We learn every week about this COVID-19 more and more stuff. Yeah. Okay, right. Again, going back to another question. So employees will be accessing this vaccine through Axion, our platform for influenza, and then they'll go on to the clinic to get the vaccine. That was a clarification somebody needed. What's the youngest age one can take this vaccine? Deepthi, you want to take that?
So again, we are going back to the same question that was previously asked. So we still don't know the real science behind this. There are certain companies who have not tried this vaccine in the trials in children. So we still don't know. Probably 18 and more, because younger kids or younger adults, when they get the virus, they don't get that sick. And based on that alone, we can say this is the bulk of the vaccine targeted for the adults, like the classic age is between 20 to 55. That's the working crowd. That's the crowd that moves around, taking care of your elderly, taking care of your kids, and so on.
There's one question from a hospital volunteer. Can the hospital volunteer receive the vaccine? We commend any volunteer, so I'll make sure that you get it if you need it. Just approach me. Even if you're not a hospital employee, we'll be happy to do that for you. I'm coming to the end of the questions. Deepthi, you want to make some closing statements? Then I'll say a few words, please.
Sure. So, ladies and gentlemen, this is a tough topic to discuss because there's only a limited data available to us. But we should be glad that these scientists who worked tirelessly last 10 months have come up with several vaccines at this point. They use different platforms, and mRNA platform had never been used before, but it's all about safety and efficacy. Safety comes first, efficacy comes next. So far, the data has shown that these vaccines are safe and efficacious, are effective, but reality is that unfortunately, folks, we are running out of options, right? We thought that we were doing okay after the first wave, and although we were predicting this or forecasting this, that there's going to be a second wave, and it's happening right in front of us. Now, when you go back to 1918 pandemic, there were third and fourth waves as well, killing 50 to 100 million of people. But these are modern days. We are using modern technology. So with the vaccine developers used modern technology to come up with their version of the vaccine. So that's all we could say at this point. At the end of the day, you need to discuss, you need to think things over, you need to discuss with your family, loved ones, and friends, and make that tough decision whether to take. I don't think we are talking about long-term safety issues at this point. That's one of the common questions that we get asked. Long-term, will there be long-term effects? It doesn't look like it. When you talk about all these vaccines that we've taken over the years, what are the chances of getting long-term effects? Basically next to zero. So, folks, I'm going to say it again. This is the only exit strategy we have other than wearing masks and washing your hands and distancing. If you don't have an effective vaccine, it'll be impossible for us to get rid of this pandemic, at least for a few years.
Yeah,
Thank
I echo his thoughts there. But, Deepthi, I'm going to take another question here, which is interesting. I've not heard about this one. Does the vaccine contain MRC5 cells?
MRC5s. I'm not.
We will research ourselves and get you that answer. More questions about whether this is mandatory or not. Clearly, it is not mandatory for the employees, please, for now. We don't expect that, but I think it's strongly recommended. I think it's prudent to take it, especially in this very difficult period we are going through our lifetime. So, basically, it's an evolving topic. We will come back with an update as soon as we hear more from the health authorities. There is trepidation, but as Dr. Jay says, that it is a personal decision, but he will take it, I will take it, we recommend it, and we will update you as soon as we hear more about this. And I'm going to end this talk by saying, stay safe, be positive, but stay negative. Thank you so much. Really, it's a great topic, of course, and a great talk. Thank you so much. And this will end the webinar. Thanks.
As COVID-19 spread during the past few months, you were told home is the safest place. While you were at home, we were here, caring for patients and working around the clock to make Emanate Health a place you feel safe coming back to for all your healthcare needs. Our top priority remains to provide quality healthcare services in a safe, compassionate environment to our communities in the San Gabriel Valley. So here are 3 things you need to know. We are open, we are safe, we are clean. We are now offering a full range of elective surgeries at our hospitals and facilities. We are also taking appointments at our outpatient services. For non-emergency health needs, our ER check-in tool is also available for patients visiting our emergency rooms. Please don't delay the care you need. Call your doctor to make sure this is the right time to schedule a procedure or appointment. If you don't have a physician, use our Find a Doctor tool on emanatehealth.org. Emanate Health goes to great lengths to protect every single patient and staff member. These safety protocols are in place across our healthcare system. Everyone who comes to Emanate Health is required to wear a mask and is temperature screened. All patients scheduled for an elective surgery are tested for COVID-19. For pregnant patients who have a scheduled induction or C-section at our freestanding Family Birth and Newborn Center, testing for COVID-19 is administered prior to their due date. Our waiting areas, including those in our emergency rooms, have seating placed 6 feet apart to enforce social distancing. All suspect coronavirus patients who come to the ER are placed in a separate area while they wait for further care. Our admitted COVID-19 patients are placed in isolation units on a different floor from everyone else. We are limiting guests from visiting our hospitals and limiting access to hospital entrances to keep everyone safe. We have implemented tough antivirus cleaning practices to protect the health and wellness of everyone. These cleaning protocols include disinfecting our hospital rooms with an electrostatic sprayer. The fine mist penetrates hard-to-reach places and kills viruses in 30 seconds. Using state-of-the-art air purifiers and moonbeam UV lights to neutralize pathogens like COVID-19 for high-risk patient rooms. Wiping down counters, handrails, doorknobs, and other high-touch surfaces multiple times a day with EPA-approved disinfecting wipes that kills viruses within a minute. Installing more hand sanitizer stations at points of entry to our facilities, and providing surgical masks for all patients and staff who need them. Safety is part of our mission at Emanate Health. We're doing whatever it takes to make sure you feel safe to get the care you need when you need it. Our doctors, nurses, and healthcare staff are here to provide emergency, primary, and specialty care for you, our communities in the San Gabriel Valley. Thank you for always trusting us with your care. Welcome back to Emanate Health.